So the whole idea of case taking, Hahnemann has given the details about case taking in aphorism 83 to 104. But the gist of case taking, the process of case taking, or what is important for case taking, is given much before that, and that is given in aphorism number 5. So if you want to learn case taking, if you want to master case taking, the first thing that you want to understand is what's written in the aphorism number 5. So let's read aphorism number 5. And aphorism number 5 states that useful to the physician in assisting him to cure are the particulars of the most probable exciting causes of the acute disease. So when you have an acute disease, the one thing that you need to figure out, the one thing that you need to find out is what is the exciting cause for this acute disease. And the whole process of case taking should be centered around that in an acute case. For example, we all know that in aconite, we say that in aconite a person falls ill when there is exposure to dry cold wind. A pulsatilla can get sick by eating rich food or by entering warm room. A bryonia can get sick by change of temperature. A nux vomica can get sick by sitting on a cold pavement. An arsenic elk can get sick by eating stale food. So we know that these are the exciting causes of an acute disease. So in an acute case, the whole case taking is centered around what is it that has deranged the vital force suddenly. That derangement we need to figure out. And the whole idea of case taking is, let's try to find out what is peculiar at this point of time in the case and what has led to this derangement of vital force. And in this process, we need to sometimes I have a large pediatric practice, and in pediatric cases what we need to do, often we need to do is that the parents will often come that the child has cough, the child has fever, or the child has caught an infection from the other children in the school. But then you ask, there are 50, 30, 40 students in this class, why are they not all sick? Why is this particular child sick? Why is this particular child catching an infection? Why this child is complaining of pain in abdomen, recurring pain in abdomen, and not most of the other children in the class? And that is where the process of case taking begins. Trying to understand why this particular child has fallen sick in the same atmosphere. So the telluric atmosphere is same, but the other children have not fallen sick. That means there is some individuality in that child that predisposes that child to falling sick. So on one hand, we need to figure out what is the PQRS in the case right now. The modalities are important. The symptoms which are very strong, they are important. It's not necessary. We at times even need to focus on the common symptoms, because the common symptoms sometimes give you an indication of what remedy the patient might need. For example, it is very common for children to develop redness of face in fever. Now, if we know that the face is red, okay, so there are many remedies, but the one remedy that comes immediately to our mind is belladonna. There is flushing of face. Even calcarea has that in fever, but calcarea in later stages has more paleness than flushing. So if there is a lot of flushing of face, there is redness of face, even though it's a common symptom, it can indicate a remedy like belladonna. But the moment there is flushing only on one side, there is only on one side, it could indicate, and the other side is not flushed, then it could indicate another remedy like cinna or chamomilla. Similarly, if there is flushing of face and at the same time there is flushing of nose also, it might indicate a remedy like Ocimum sanctum, a very good remedy for acute viral fevers. Now, so the whole idea is that the observation is very important. In acute cases, the patient's observation is very, very important. How the physician observes, how the child is behaving, what are the child's energy levels, what are the food cravings of the child. And this is very important because the one mistake that I often see doctors making, homeopaths making, is that when the child comes to you in an acute stage, the physician often asks the parent, what is it that the child likes to eat? But this is a wrong question. Because what the child usually likes to eat or what the child usually craves is not what we are seeking in an acute case. What we are looking for is what has the child asked for since the acute disease has begun. जब से बीमारी शुरू हुई तब से क्या खाने का मन कर रहा है बच्चे का. That is what we need to understand. And that is what we need to ask also. कि since the acute complaint has begun, what is it that the child has craved? What is it that the child has asked for? Or what is it that the child has happily eaten? Because when the child is sick, the mom will give the child many things, will offer the child many things. But what is it that the child ate happily?